My name is Colin Driver. I'm a veterinary neurology and neurosurgery specialist here at Lumbry Veterinary Specialists in Alton. My first introduction to Fujifilm was through a colleague who recommended that we give the mobile digital X-ray solution a try with our patients. And I think when we first started using it and we realised that there were a number of applications that would make our workflow a lot easier in the hospital, it sort of intrigued us as to what other solutions were available and how we could also build those into our clinical work in the hospital. So I have experience of using C-arm for intraoperative fluoroscopy previously. However, space is definitely a premium in veterinary operating rooms, and one of the challenges when we have a patient and a lot of surgical equipment is how we make best use of the floor space. So where we have a solution which has a small profile and also doesn't have cables running all over the floor, we're able to work with that solution in a much more free and adaptable way. So with time, we've actually found that we can build it into the work that we're doing much more and more. And I think we're sort of at the, just seeing the tip of the iceberg really in terms of the ways that we could utilise the cross in veterinary orthopaedics and spinal surgery. So just off the top of my head, I can think of various applications. I would think placing screws, making sure where those are in relation to a joint space, for example, particularly the proximal screw on a TPLO plate. I think that would be a good thing to check. And intercondylar fractures, humeral intercondylar fractures or fissures, intraoperative fluoroscopy can be very helpful with those as well. And then of course from my perspective, we've been using it to place screws into vertebral pedicle or body for various applications where we need spinal fixation in dogs. And the nice thing as well with the cross is the flat detector plate means that I can work directly alongside the unit. I'm really free with my arms to be able to use the drill in a way that I would want to be able to place accurate and safe implants. I think my first impressions were, obviously it's a very smart looking unit, it's also quite compact. And then of course you see the floor and you see the lack of several inch thick cables running around and you realise how free that makes the team and the ability to have then additional equipment in the room as well alongside it if needed. It's very useful having the extended display. It means that when a colleague of mine is manoeuvring the cross, I can see exactly what they see as they expose the patient. And I can make any suggestions in terms of adjusting position very easily.
My name is Kerry Morrison. I am a nurse from Northern Ireland, but I now work in neurology. So I work very closely with the MRI machine and CT scanner, and we use lots of cool equipment in theatre like CT fluoroscopy and in theatre radiographs. I've never used anything like lacrosse before moving to Lumbry Park, and I have worked in busy referral hospitals before. It's really effective when we're doing spinal stabilisation surgeries. It helps our surgery time so much. It reduces it to at least an hour or less by using it in theatre, and the image quality is really good. To be able to see the screw length and depth in the vertebrae, oh my God, it's amazing. The first impressions was like, wow, it's like, how am I going to use this? Like, it was just looked like something quite futuristic, but in reality, it's so easy to use, and it, as I said, helps in theatre so much. Really easy to clean, it's really easy to maintain, and it's quite good at getting the sterilisation packet over the arm as well. And all in all, it's really effective and efficient during our surgery times.
I'm Victor, one of the diagnostic imaging resident here at Lumbry Park, veterinary specialist. We're really surprised with the range of movement of the C-arm because it's like a small unit compared with other ones. So for a mobile one, I think it's quite slim and quite small, and the image qualities are really good. And the range of movement that we've got with the C-arm in the 360 degrees, we can cover like all the surgeons and all the patients. with too many cables around theater is sometimes can be a little bit tricky. For example, to keep like the area of surgery completely sterile. So with a portable one, as I said, it's just so tiny, and so you can put it whatever you want, and it's not as heavy, so it's quite slim. So at the end, it's quite easy to manage. Sometimes we need to move like 1, 2, 3 millimeters, and with other brands that I've been working with, is so difficult just to move these 2, 3 millimeters. So sometimes it's like we spend more time than we wish just trying to put the C-arm in the perfect, or the angulation in the perfect degree that we like.
The impact for my procedures has been quite significant. I think intraoperative fluoroscopy is something that we always knew that we could have access to, although at a significant challenge in terms of staff utilisation, floor space and time. Whereas now that we're working with the Cross, I know that it's absolutely no bother to get a procedure up and running with the system, and so with time, because we're becoming faster with the way that we do things, because the learning curve, if you like, is not steep at all. You know, it's actually possible for staff who are already aware of our RPA regulations, our local radiation regulations, they're able to adapt to use the Cross straight away, because the user interface is so similar to the Nano, of course, but then otherwise it's also just very simple with the presets that it has. So because we're building it more and more into our workflow, this is having a very positive knock-on effect for our patients in terms of the safety and the accuracy of the surgery that we're doing. I can see myself using the Cross for other procedures in the future. Much like in human healthcare, I believe progress in veterinary surgery will be in minimally invasive procedures, and intraoperative fluoroscopy is very helpful for that in guiding where to make the initial incision. So as we progress with time and more instrumentation from human surgery becomes available in a veterinary context, those additional tools like the Cross, for example, are going to really allow us to progress the science in a positive way.